What can I do when my eye does not produce enough tears? Will that get better with therapy too? Thank you very much for the question. Good question. There could be a couple of several reasons why the tearing of the not enough tears. First, it may be experienced by the patient as not enough tears if the blinking is either less often or less complete. The eyelid doesn't close fully. Then, of course, the lubrication by the tears, even if they are produced in sufficient quantity, may not be enough because the eye is exposed to the air and to the wind and to the other factors for longer times than the healthy eye that is blinking normally. That's number one. Secondly, it could be some irregularities in the function of the lacrimal gland, which is not happening very often, I would say, from my experience. But it can. But of course, with stimulation and in the process, we can reasonably expect that it will become better. And the third of the most possible reasons is that the lacrimal sac here in the corner of the eye is also controlled by a very little, really tiny muscle that keeps the sac closed, and it opens when we blink. When we blink, it opens a little, letting a drop of tears out, or when we are crying, or when the eyes are irritated, or the wind blows, or whatever other factor may be present, then it opens wider and leaves more tears, lets more tears out. So it can happen that this muscle, because it's also innervated by facial nerve, has become contracted, so it does not function really properly. So when you blink or when you want to cry, it just would not open widely enough to let sufficient tear liquid to the outside. And we have experienced many times that what is called crocodile tears, for example, is the other extremity, when the person is having a tearing eye when he or she is eating, for example, or speaking. It's also becomes better and even disappears completely within reasonably short time. Normally it's within 2, maximum 3 visits we have it. We even have had one patient, that gentleman, after the very first working session, he was sitting in the train and he started to eat the apple, and all of a sudden, because he was having very heavy what's called crocodile tears, and on his way home after the very first session, he realized that his eye was not tearing any longer. He was so much excited, he just called us from the train. He said, listen, I am having this and that. But it's just an example. It may not be every time that quick, but it's possible to improve.